Hi everyone, this is Dr. Parissis here, and we are having fun today. We've got no surgery, so we thought we would test out a few new products sent over to us. And those products are for making incisions. Now, incisions are the cuts that we make to insert grafts into once we've taken the grafts from the back and sides of the head. So the first, I want you to have a look at our lovely patient here, this eggplant, and I want you to focus your attention just on these incisions here. These are the incisions that we made using this implanter pen. This is a new device that was sent to us that we thought we'd test out. We're always kind of looking to advance our practice and keep up with the latest devices and technology. So we thought we'd give it a go. And we thought we would compare it to our own style of creating incisions. If you can see just again here, these are the incisions that we made. If you look at them, some of them are kind of larger than others. They look a little bit messy. Obviously there's going to be variation in how good they look depending on who's using them, but we've used implanter pens before, and these are the kind of incisions that this particular one made. So not so impressive. And we were also sent some new needle sizes, and this is one that we tested out here. These are the incisions that this needle was able to make here. So right around about here. So you can see they're not perfect. They're better than the implanter pen incisions here, but certainly not perfect. And then if you look at the incisions that we made using our own custom cut blades. Now these blades are made using a special device that's quite difficult to get your hands on. And what we do is once we're cutting the grafts under the microscope, we take a look at the size, because the size of your grafts vary. One person might have very long and wide grafts, another person might have very small and narrow grafts. So we always customize our incision sizes so that the grafts slip into the incisions perfectly. So these are the incisions that we made using this one. So this was a this particular one is actually a 0.85 millimeter, but these incisions were made using a 1.15 millimeter blade. You can see they're much more uniform, much more symmetrical, much cleaner, and this is going to impact healing. It's going to impact the amount of bleeding, and bleeding gets in the way of making further incisions. If there's a lot of blood around because of things like this, then it's going to make it more difficult to make more incisions afterwards. So this is why we are, at least at the moment, definitely going to stick with the custom cut blade incisions that we currently use, but feel free to send us any further devices if there's any companies out there that want for us to test them out. And I hope you guys enjoyed this video. I'll see you in the next one.